It's my pleasure to welcome you to our Alumni Innovators Speaker Series. My name is Derek Yonai, and I am the director of the Brown Innovation Center. Tonight's speaker is Schlegel alum Devon Schlegel. Devon is a board-certified art therapist, licensed mental health counselor, abstract artist, and yoga instructor. She is the co-owner and clinical director of Indigo Art Therapy Studio, located in Jacksonville, Florida. In her clinical work, Devon provides art therapy to children, teens, and adults, as well as professional supervision to art therapists working towards their board certification. Indigo Art Therapy is the only practice of its kind in the area, and in 2023, it was awarded the Best Small Business Award from the Cultural Council of Jacksonville for their service to the community and their contribution to the arts. It was also voted Folio Weekly's Best Mental Health Clinic in Jacksonville. Devon graduated from Schlegel in 2010 with her bachelor's degree in psychology and obtained her master's degree in art therapy from Drexel University. After graduation, she gained experience in various settings and implemented 2 art therapy programs within Philadelphia Public Schools. She is a past recipient of the Most Active Artist Award from the Delaware Valley Art Therapy Association, and her work has been featured in Jacksonville's The Lark Gallery as well as Jacksonville Airport. She teaches power yoga and implements yoga and mind-body awareness into her trauma interventions during art therapy sessions. Devon's therapeutic style incorporates aspects of process-focused art making, mindfulness, and somatic therapy. Tonight, she's with us to talk about innovations in art. So if you would please join with me in giving a warm Schlegel welcome to Devon Schlegel.
Thank you. So I am an art therapist. I'm not a public speaker, so bear with me. I'm also really fighting the urge to say how much this place has changed since I've been here, but I'm not going to say it. It's going to age me. All right, so we're going to talk a little bit about art therapy today. As mentioned, I am co-owner of Indigo Art Therapy Studio. We are located in the San Marco area of Jacksonville. And art therapy is like one of my favorite things to talk about, so we're going to talk about it today. This is sort of a general plan of how I'm hoping tonight's going to go. We're going to talk about what art therapy is. We're going to talk about process over product. You're going to hear me saying that a lot. It's kind of like at the core of a lot of art therapy principles. We're going to talk about using art in therapy, and I'll chat a little bit about Indigo, and if you're at a table you notice that there's some art supplies and some paper. If we have time, I'll lead you through a little bit of an experiential, and then we'll do question and answer. Might be overly ambitious, might skip some things, but we'll see what happens. Okay, so what is art therapy? Our licensing board is the American Art Therapy Association, and they describe art therapy as a mental health profession that enriches the lives of individuals, families, and communities through active art making, creative process, applied psychological theory, and human experience within a psychotherapeutic relationship. That's a lot of words. So, over the years, I've sort of had to develop a little bit of an elevator pitch as far as what my job is, and so the best way I can describe it is that it's the same as talk therapy, except we use art making as an alternative way of communicating in the therapeutic session. And art inherently is a calming, sometimes it's calming, sometimes can be stressful, but art making can help people let their barriers down in session. So we'll talk a little bit more in a moment about what that looks like. So what I want you guys to consider for a moment is like an important moment in your life. It can be a positive memory, something that sort of stands out to you. And if you were to close your eyes and kind of imagine reliving that experience, it's usually not just words that come up, right? You usually experience, you usually might see colors, you might see images, you might even feel somatically in your body a reaction to that memory. And that's sort of at the core of what art therapy is. It delves deeper than just words in talk therapy. And while schools and textbooks and my grad school talked about how art therapy has been around since the 1940s, that's when the field kind of really became established. I mean, art as a healing power has been used for centuries, right? And it's been used for rituals and documentation in the form of Native American cave paintings, Egyptian temple art, Chinese medicine, and African sculpture. I mean, we see it everywhere. So art therapy definitely does not own the power of art, but we do sort of incorporate it in a therapeutic manner. What else? So what makes art therapy different from traditional talk therapy? Obviously, the use of art media as a means of self-expression and communication. It also offers the ability to identify the different meanings present in visual expression. So what that means is sometimes in an art therapy session, we create something and we've created something that both the therapist and the client can look and reflect on. And so you can really sit with one memory, one feeling, and dig into it a little bit easier. And the creative process in general has therapeutic benefits. So who are art therapists? Art therapists are master's level clinicians, and we're trained both in psychotherapy techniques, like if you went to grad school for counseling, you would learn a lot of what you would learn in art therapy, but we also learn how to implement art in a therapy session. We learn a lot of theories around art making, a lot of theories about different art materials. I'm going to chat a little bit about that today. And art therapists can kind of work anywhere you see people needing support. So you might see art therapists in a psychiatric hospital or in a medical hospital. You might see them in rehab centers or in prisons, community centers, schools, etc. Also outpatient private practices, which is where I have landed. And artistic skill is not necessarily required to be an effective art therapist. Usually, if you are interested in sort of following that career path, the graduate schools will ask for a portfolio, not because they necessarily want to make sure you have the skills, but more that you've had experience with different art materials. They want to make sure that you've had experience with paint, with clay, with drawing. And in a session, definitely art skills are not necessary to be in an art therapy session as a client. Honestly, I feel like the artists that come and do art therapy, they're almost they have a little bit more of like a boundary to work through because they already have an aesthetic. They already have that sort of feeling of, I really want to create something that looks good. And in art therapy, in those sessions, it's about the process of art making. It's not about finishing and creating like a pretty picture. So sometimes artists are a little bit, they find that challenging initially in a therapy session. So let's talk about art as therapy versus art psychotherapy. So depending on what I'm doing in a session, I might use both of these, but essentially, depending on the situation, could be used even together. Art as therapy generally is the idea that art making itself is relaxing and is calming. It embraces the idea that art can build self-esteem, it can increase mindfulness, promote relaxation. I might use it to help build rapport with the client. And then art psychotherapy, that's actually much more deeply rooted in traditional talk therapy. So art activities that we might do in a session might be processing specific traumas. It might be processing thoughts and feelings. And the idea here is that art is seen as a reflection of the individual's inner world and is interpreted in collaboration with the client. So I think sometimes the idea about art therapists is that like you're going to draw a picture and you're going to hand it to me and I'm going to say, okay, well, you clearly have, you're clearly struggling with this, and you had a traumatic event when you were 6, and all of this, and that just is not true. There are certain things that we do look for in a drawing. There are assessments that some art therapists might use, but really the thing that we want to keep in mind when interpreting artwork is context. So an example of that might be I might have a client draw a picture and they include like a drawing of a snake And initially I might think that that snake represents something, insidious or something scary. If I was Freud, I would have something else to say about the snake altogether. But then if I ask more questions of the client, I learned that they had a pet snake growing up, and the snake is like a comforting symbol for them. So it's always important to keep in mind that personal symbolism, it could be very different than what like universal symbolism would be. Let's see. All right, so let's talk about process-focused art making. Process-focused art making focuses on the process instead of the product. So that really encourages an opportunity to practice mindfulness. And this is a really hard thing sometimes for people to initially kind of accept and get over. I think mostly because at some point when we were probably like in elementary school, someone either told us we were good at art or we were bad at art, and that just sort of informed our relationship with art moving forward. I obviously am biased, but I feel like everybody has the potential to be an artist. There's no wrong way to make art. But if you've believed that you're bad at art and you can only draw stick figures and you couldn't even draw a straight line, then like unlearning that can take time. This process-focused art making really allows an opportunity to kind of sit with the inner critic that might come up while you're art making, and practicing non-judgment. So that's a big part of it. Noticing when you have those thoughts about what I'm creating is bad, or I should have done this, and trying to work through just observing them and knowing that thoughts aren't necessarily facts, right? Everything we think is not true. Okay, so art materials. We will use any type of art material in an art therapy session. It kind of just depends on what the client needs to work on. It might depend on the mood of the day. We might use paint, we might use plaster cloth. We've done like textile work in the past, some sculpture. Sorry. But what we really want to think about, I'm not just throwing art materials at somebody, right? There's a thought and there's a theory behind it. So art materials exist on a spectrum. Thank you. That's good. It gives me an opportunity to like breathe. Okay. So art materials exist on a spectrum of like rigidity and structure and resistance to fluidity and things that are unstructured. So something that is unstructured might be watercolor paint, it might be finger paint. These are things that are really hard to control. And then on the other end, on the very other side of this, we have colored pencils, markers, things that are pretty easy to control. And so thinking about this is an important consideration when I'm working with clients. The material is going to be a tool that I use to help them reach their goals. So, for example, if a client comes in and they're really anxious, if they're like really rigid, they might only initially feel comfortable working within the materials that provide a lot of control. They're going to feel comfortable using pencils because they might make a mistake and they really want to feel like they can undo that mistake. And so if they're new to the art therapy environment, I'm going to let them hang out in that sort of comfort zone a little bit. But as the therapeutic relationship grows and moves on, I might encourage them to move a little bit into like the clay, the pastels, the watercolor. So moving from that really resistive art material into something a little bit more flexible. And so in that scenario, the materials are used kind of as a metaphor or like a vehicle to practice letting go of some control. So the art therapy session is a like more safe and comfortable environment to be like, what is it like if I sort of release control over those things? And so eventually we sort of talk about what that would look like outside of a therapy session. And likewise, if a client comes in and they're having difficulty regulating themselves, their emotions, they're really upset, they're having trouble controlling their body reactions maybe, I might not want to give them finger paints because they might need that structure, they might need that grounding tool that is a little bit more resistive. And yeah, so let's see. Oh, just as a note, I hate chalk pastels. That's not an art therapy thing. That's just me as an art therapist. So usually oil pastels are what we would use in a therapy session. And oftentimes that's going to be something that I talk to a client about when they first come to session. Is there any sort of sensory thing that you have against certain materials? If someone is uncomfortable using a certain material, I'm never going to ask them to use that, because I want to make sure that they feel safe. Okay, expressive therapies continuum. I kind of went back and forth about whether to touch on this, but I think it's really interesting, and I remember when I learned about it, it sort of affected how I watched, how I myself interacted with different expressive media, and I kind of watching other people interact with expressive materials as well. So this is a theoretical model. This isn't something that I think about before every session, but it is something that helps us understand how we as humans interact with art, various types of art. So not just visual art, it could be music, it could be movement, dance, whatever. And so the idea behind this is that a lot of art therapy, not exclusively, but especially a lot of the work that I do is trauma focused. And so that means that we take a bottom up, what's called a bottom up approach in sessions, which means that we start down here. Instead of talking initially about, what are your thoughts, what are your feelings, how can we solve problems, we talk about what you're feeling in your body in the moment. And by starting with our body's like sensory and somatic experiences as the foundation, it sort of helps us build that foundation before we can move a little bit deeper into feelings or cognition. So let's hang out here in the kinesthetic sensory level for a moment. In this area, a lot of the art making is going to be focused on action and sensing. So art materials may only be used kind of as a vehicle to invite movement into the body. They might be tearing paper, they might be crumbling paper. I might have them do a really big, large-scale drawing where they're using like their full movement of their hands. And this is, so that would be more kinesthetic on this side. Which is, we have it sort of divided into left hemisphere and right hemisphere. So the kinesthetic side is really big body movements, the movement of the body, and then the sensory side is sort of the feedback that we get from art materials, what we feel in our body when we're interacting with art materials. So if I was trying to bring a client a little bit more into this level, into like the sensory area, I might incorporate some clay or some plaster cloth, something that really allows them to pay attention to kind of the feedback that they're getting from their body. And also a really good way to think about this first level is like, this is a lot of what happens in like really early childhood. So if you see, I have like a 10-month-old, and like I know when he's upset because he's screaming, but he's also like kicking his feet. And you see like older kids stomping their feet, sort of reacting in their body. So we sort of think about this almost as like, this is really early childhood, this is middle childhood, and this is like the teen years. And so perceptual affective, right here, the middle one. This has to do with the awareness of and the use of art materials and form on the perceptual side, and the experiencing and representation of emotions on the affective side. So, however, the focus is expression of emotion rather than the form of the artwork. So we're not paying attention necessarily to, again, it kind of comes back to that process-focused art making. We're not necessarily paying attention to what the piece looks like. We're paying attention to how we feel as we're creating it, the emotions that are coming up. If I have a client who's hanging out and creating kind of on this side in the perceptual level, they might be sort of drawing a very specific experience. I might have them draw a very specific memory. So this is sort of just more straightforward. What do you remember about this memory? Who was there? That sort of thing. And then affective is going to be, a lot more internal, your affect, your feelings. So if I was working with somebody who I wanted to move over a little bit more to the affective side, I might have them paint a feeling that they were having or an emotion that was tied to a memory. And then the third level is going to be cognitive and symbolic. And the cognitive component emphasizes like the logical and the analytical thought processing that comes with a art project. So what is the goal? How are we going to get there? How am I going to problem solve this task? So that this might sort of involve more step-by-step processes. And then the symbolic side looks a lot at metaphor and symbolism. I love this side, the symbolic side, because we can really learn a lot about kind of our personal symbolism, and sort of this helps us connect with the other side as well. And this also really resonates for me as far as like if this is like the teen years, right? Because I think about teens and they have all of these very meaningful symbols, right? We sort of, as teens, we sort of attach ourselves to specific symbols, whether it's, I don't know, like, I'm gonna age myself, but like a peace sign or that like S thing. Did anybody ever do that? Yeah, I don't know what that's called, but like, man, I love doing that. And so we really, as teens, sort of like grab on to the symbolism. And so at the very top, you see creative. And this is sort of the combination of all of these things happening all together. This is what someone might call artistic flow. If you're an artist or if you're a musician or if you're a dancer, this is where time sort of melds away and you're like, oh, like an hour just went by and I don't know where that time went. So the creative is sort of the collection of all of these things happening at once. So, like I said, not every session is going to include all of these levels, but it helps the therapist to understand the continuum of how we are practicing self-expression, paying attention to where the clients feel comfortable. So this is something I'm going to sort of note in my mind after like the first session or two. Oh, this client really enjoys the kinesthetic. So I'm going to play around with eventually moving them over here. There's no like right or wrong place to land. It just sort of helps us conceptualize and understand what's happening when we are creating. Let's see. This indigo. I just like showing it off. This is actually our third building. We had 2 other locations. We were fully virtual for almost a year during COVID. Man, if you ever want to get me like talking and never stopping about, just ask me about what it was like being a therapist during COVID. Oh my God. So this is my office, Indigo. We have 4 therapist offices. We have a nice, really big space for groups or yoga groups. Sometimes we do that. And we have 5 art therapists that work with us. And we actually just hired a dance movement therapist. Really excited about that. So we're kind of expanding a little bit. I'm excited to learn about dance movement therapy. I don't know a ton about it. So what do we offer at Indigo? We offer individuals and groups, arts and wellness workshops, virtual and in-person, community outreach. And I think there's an overall like misconception that art therapy is only for kids. The oldest client I have is 70 years old. Like the youngest one I have is like 9, and that definitely keeps things interesting going from like a session with a 9-year-old to like a 60-year-old. But art therapy is, I mean, it's really for everybody. It's not just for kids. And I think that tapping into art making can sort of help us access that like inner child, and help us access that like playfulness and curiosity. So we, myself and my partner, Kelly, who owns the studio with me, over the last, let's see, Indigo's been around since 2017. So maybe over the last couple years, probably started around 2020, we started talking about what do our beliefs as a private practice want to be? What do we kind of want to stand for? The first is that we want the healing power of the arts to be accessible. And so what that means is accessible as far as space. We want to make sure that our space is accessible for maybe neurodivergent individuals or those with sensory sensitivities. It's accessible because we offer virtual. A lot of people just can't make it to the studio. And we also have worked to make our services more accessible through like sliding scale. We do some pro bono stuff. And we have community partnerships where some community organizations sort of fund people to come and receive art therapy with us. And the second belief is, this is a fairly new one that we've been sort of working with that has been an ongoing discussion, which is that art and therapy are political. And so I learned in grad school that like when you go into a therapy session, you are like a blank slate. Your client shouldn't know anything about you. I remember a supervisor once telling me that like if a client asks you if you're married, you say, why did you ask me that? Like, you know, why is it important that you know that? Well, it's important that you know that because I'm sitting across from a human and I'm sharing my trauma and I want to see the other person who's listening to me as another person. So the thing that we have sort of been expanding in terms of art and therapy being political is that our mental health does not exist in a vacuum, right? So like you can go into your therapy session and you can talk about depression, you can talk about anxiety, you can work through relationship problems, whatever it is that you're sort of coming to talk about. But you can't change the things that are happening around you. Those are things that directly impact your mental health. A large part of our clientele are in the LGBTQ community or are individuals that need access to reproductive health care. And those are things that directly impact their day-to-day life. And so, you know, not acknowledging those things and not acknowledging sort of how our environment around us affects our mental health, we just sort of decided that not addressing that at all was just, it was doing a disservice to our clients. So let's see, what else? Art therapists and art making. I just threw a couple of my pieces up here. In an art therapy session, I'm not going to be creating artwork. I might be doodling just to kind of make them feel a little bit better. Nobody likes to be like stared at while they're making art. So I might be doodling, but I'm not really making my own art. But I will say that my work as an art therapist has really informed and deepened my practice as a visual artist. Actually all of my pieces at this point are reflections on like memories or processing emotions. They might be things that I've talked about with my own therapist. And so in that way, I'm like art therapizing myself, I suppose, in some sort of aspect. But every art therapist has kind of a different relationship with their own art making. Some of the art therapists that we employ don't really make art too often outside of work. One of the art therapists that work with us has like an art making business, so it just sort of varies. Okay, y'all didn't think you were going to come here and like not make art, right? So we're going to do some artwork. I have all of the tables have got some art supplies, but I know we got a lot of people over here. If you can find a surface, if you're standing and you can find a surface, grab a piece of paper and some materials. Take a minute or two, and then we'll talk about what we're
Oh, crayons.
Those are crayons. No, the color pencils. I don't know if we met
We've got a bunch more paper up here, so y'all need Alright, Alright, so we're gonna do an activity that I might like start an art therapy session with. This is something that I also start an arts and wellness workshop with. So this is not art therapy. This is sort of arts as a means of practicing mindfulness. So we often do arts and wellness workshops, which sort of talk about how to link art making with mindfulness. And so we're going to do a breath portrait. This is one of my favorite ways to sort of shift focus inward, to ground ourselves. So I'm going to describe how to do it in a second. But if you're a visual person, this is sort of the idea. So what we're going to be doing, and I'll tell y'all when we're going to be starting. But we're going to be linking our movement of our drawing material with breath. So think about it as like a slow motion scribble. We're going to move our hand as we inhale, and we're going to move our hand as we exhale. Don't feel like you have to keep it sort of going up and down. So we're going to take, this is like a two-part thing. So there we go. Okay. So this is a two-part thing. We're going to do our slow motion scribble, and then we're going to do the second part. So choose a color, find a place on your paper to start, and take a breath in. Everybody take a breath in. Allow your breath to guide your hand in any direction it wants to go, and then let it out. So think about that. You're slowing things down. Taking an inhale and an exhale. We usually do about like 4 or 5 breaths, but check in with your body, see what you need. Maybe you need more. Maybe you need less. Alright. So what I found in my work is that a blank piece of paper can be really, really intimidating. So by giving somebody permission to just sort of scribble, you've already gotten the hardest part out of the way, which is just making a mark. Sometimes just making a mark is like the hardest part. So if we had a ton of time, I would want to give us like 10, 15 minutes, but take the next couple minutes, use that scribble as a jumping off point for an abstract piece of artwork. So lines, shapes, and colors. Feel free to play around with the direction of your paper, maybe rotate it. And I didn't review our art supplies, but we've got colored pencils, markers, oil pastels, and paint sticks. And so up here we've got some mindfulness tips in terms of how to use art and mindfulness. Incorporating some playfulness, some curiosity, some non-judgment.
Me too, Jessica.
If this was a workshop, I might encourage somebody to encourage you guys to tap into your senses. So obviously, you're seeing the colors, you're seeing the shapes, you're seeing the lines, but is your material, do you hear anything? Can you hear the pencil on paper? Can you hear the marker on paper? Does your art material have a smell? How does it feel in your hand? How does it feel to sort of sweep your hand across the paper? And feel free to keep working. I get asked a lot, sort of like, okay, I've made art in an art therapy session, now what? So I just sort of included some questions that I might ask somebody, especially if this is more of an arts and wellness workshop. I might ask you guys what you observed as you created Might ask you guys how you problem solve, if there's a part or a section in your piece that you're curious about, if there's a section of your piece that you're particularly happy or unhappy about. I might have you reflect on any feedback that your body might be giving you. If you notice your breath slowing down, just making our work make you feel more anxious, that is also a thing that happens. And so also sort of creating and holding space for the fact that art making isn't necessarily always calming for everybody at the first time. So if you are not enjoying this or it's stressing you out, that's totally okay too. And feel free to keep working. I brought all these art materials, but I forgot business cards. So all my information is up here. You can follow the studio on Instagram. Feel free to email me with any questions. We are actually, in terms of increasing accessibility, we are launching our first no-cost virtual art making workshop. So if you go onto our website and you sign up for our newsletter, I will be leading our first one. We're calling it Heart Space. I'll be leading our first no-cost arts and mindfulness workshop next Friday at 11 a.m. So if you want to log on and you want to participate, feel free. Just sign up for our newsletter on our website right there. That's all I got. So feel free to keep working. If you guys have questions, I'm happy to answer any questions you might have.